An estimated 2.4 billion people lack adequate sanitation and 1.2 billion people are without access to safe water. 90% of wastewater in developing countries is discharged into rivers and streams without any treatment. Worldwide, a child dies from a preventable waterborne illness about once every 10 seconds. Water is implicated in 80% of all sickness and disease worldwide. Water-related diseases contribute to nearly 4 million child deaths each year. What can we do to help? How can we help prevent these deaths? Awareness is the first step. We need to create a global consciousness of the problem and implement solutions. We need to unite to fight the war of water pollution and lack of sanitation. Global Health Connections was created with this in mind. This program, started by both the Center for Global Health from the University of Colorado and Rotary District 5450, joins middle and high school students in the United States to same-age teenagers worldwide to research, discuss, and together with the guidance of their teacher and a water expert, find multicultural solutions to global health issues.
I think just getting them excited about some real-world issues and coming up with some real solutions to these problems. Also, the help with we got from Rotary to supplies in Water for People to help with experts, so the kids got to actually speak with experts in the field to find out what they thought about their solutions and how they could improve their solutions.
Every semester, students in the United States participate in a Global Health Connections event in which they present their projects through skits and handouts to a group of distinguished judges.
Some wells in Bangladesh people get groundwater from have waterborne diseases. Let's hope these organizations make a good difference so that not so many people get waterborne diseases.
Well, we found out that there was a lot more problems in Africa than AIDS. There's a lot of water problems and pollution in the water, which causes lots of deaths, and we want to try to stop that by our solutions.
And we're very lucky to have Grant Wilkins here representing Rotary International, which is located in Evanston, Illinois. Grant is going to speak a little bit about the initiatives that Rotary have in place right now for water. Grant?
Thanks very much, Blair. It's a pleasure to be here, and especially to see so many enthusiastic and well-informed young people here studying this problem. Rotary has 30,000 clubs in 165 countries of the world, 1.25 million members. And through that organization, we were able to take on many health-related projects. And what's the biggest problem in our world today? It's water, safe, clean water. It kills 6,000 people every day, mostly children, waterborne diseases that you've all studied. And I congratulate you on learning about the problems in India and in parts of South America, in Africa, throughout the continent. It's a severe problem. And let me tell you how severe it is, and kind of give you some figures that you can relate to. Every 15 seconds, a child dies from lack of safe water. That's 4 per minute, 240 per hour, 6,000 every day. By 2020, which is only 15 years from now, it's estimated that 76 million people, again, mostly children, 76 million will die each year from lack of safe and clean water.
The Global Health Connections started in fall of 2003 with a pilot project at Campus Middle School in Greenwood Village, Colorado. The project was a great success.
It was last fall, that we ran a pilot project of the Global Health Connections, and we did it at Campus Middle School. And it was Jeff Poland that was really the leading light in this whole activity. So it's really a nice honor to have Jeff and his team up here winning this kind of award. So Jeff, thank you very much. We counted about 2,250 students involved in this project over the last month. And the students that are here today represent the best of their schools.
And I just think this is so exciting to see what's happened to this program from last year when we started with Jeff Poland to now, and seeing all the enthusiasm that you've generated here. So my congratulations to you. Also, congratulations to you young people. I learned a lot just by being here today, and it was a fabulous experience for me to be able to see that.
The Global Health Connections expanded to include working with Water for People, C.H. Stone Hill, the Denver Museum of Nature and Science, and other partners to provide mentors for student teams and judges for final competitions. The Center for Global Health needs your help to implement Global Health Connections as an ongoing program, helping to find multicultural solutions to global health issues. Global Health Connections needs your sponsorship and participation in this excellent community and educational activity. Why is it important to help?
It's very exciting because what it does is it raises awareness at a level where it'll make the biggest difference. Children are usually much more receptive, they're more flexible in terms of their thinking, and usually we find in the programs we work in developing countries to teach children this age about hand washing and hygiene education, they're much easier to train and much more excited than a lot of the adults. So to see the other end of the spectrum where these students have access to clean water and sanitation and feel a sense of urgency gives me a lot of hope.
We're talking about a problem that is affecting at least half, if not more than half, the people on our planet. And so having young people understand what the issues are and making a commitment to getting involved is one way that sponsors can not only help their local community by helping to educate the students in their community, but then also empower those students to take action and do something about this problem.
Global Health Connections!
To learn more and get involved in the development of the Global Health Connections project, please contact Dr. Blair Gifford at the University of Colorado at 303-556-5866 or send email to blair.gifford@cudenver.edu.